Thank you and welcome. I by the name Agre Kevin, and I'm going to share with you a very interesting topic about quality improvement in healthcare. So, I was working on a module called quality improvement in healthcare, and we have studied about different things, but I'm going to talk about health healthcare quality improvement healthcare in developing countries. So the first I'm going to answer it in form of questions. So the first one talks about how does the status of healthcare look like in developing countries. As we know, developing countries, there are those countries that are experiencing growth and development. Those countries, they are facing different challenges and some financial problems, as we know. So the health in that country is not well off, or that in most cases doesn't meet the required standards. The required standards there, I mean that the the patient's needs are not they are not full satisfied because they are having some challenges, as we know, different science, some social factors and health factors that are affecting people, and we are going to see it as down as we are moving. So these are the risk that patients are experiencing due to um, quality care. There are some risks that I'm going to talk about. Number one is about inaccurate diagnosis. Diagnosis are about when you go to an hospital, they get to ask you the signs or symptoms they had to test for your disease before they give you any treatment. So when the diagnosis is inaccurate, a patient has the risk of suffering other consequences of maybe not getting an effective medication or treatment. Also, we are having another one called medical errors. Medical errors happen to an extent that where patients are not given the right medication of what they are suffering from. You can find that maybe you go to hospital, for instance, you have a sense of headache and so on. Instead of health providers maybe taking samples of blood and give you the correct medications for the disease, it decides to give you maybe Panadol, maybe by making assumptions. Those medical errors are also some risks that are happening in developing countries. We have also unnecessary treatments because of some people are turning this healthcare industry as a business. Sometimes you are suffering from a simple disease, but because some people want to earn some money from you, they had to diagnose to you some other medication that you don't need. Those they maybe they want you to buy more medical activity and so on. So that one also happens. So another one is about providers who are lacking some basic trainings or basic trainings about providing quality services. As we have seen, we are having so many providers within the healthcare industries. So there are others who may lack the basic skills that are required, so as to provide the most and effective care. This also can be a risk to the patients. So we are also going to see which areas that needs more attentions. As we have seen, the first one is about resources, allocation of resources. Governments and other non-governmental organizations, they should put an hand in increasing the number of resources that are pumped into these health industries in these developing countries, because most of them they are lacking basic facilities, they are lacking basic machines, they are lacking providers who can more health providers who can give services at the right time, as it's one of the six aims of providing good health care is being timely and accurate. So another another one is about uh, patient safety. Patient safety involves all the measures that are taken to ensure that patient is secure from medical errors, from other diagnosis error, treatment errors, other physical errors that can happen, even emotional health. This is one of the areas that they need to look at. So to move on, another one is healthcare process. The healthcare process involves the procedure of getting healthcare services from one area to another. This one should be looked into because as you have seen in these developing countries, most of the people are not literate. They have low education levels because of poverty and other determinants of health. They are not able to um, know about maybe ways of acquiring quality services from an health facility. And the last one is about healthcare healthcare recording. As you have seen that in most hospitals, they are having poor health methods they are using to record their informations. Maybe someone may be sick for today. When you come days after, maybe 1 year, they can't retrieve your information, maybe so that they can know if it's the same disease that has been attacking you or is another new disease that is coming up. So this kind of area should be modernized to an extent that the patient can get information at the right time, maybe by going online or using the modern ways of machines. So to talk about the intervention that are required to ensure that these problems are solved. So we say the first thing is creating awareness and synthesizing people about patient safety. This is all about getting people to know what is it is patient safety, how is it achieved, what are various ways we can work to ensure that the patient safety are worked on. So patient can be given various trainings through workshops. This can be achieved maybe through community health workers, by local local governments, to synthesize people from the grassroots so that people are aware about these issues in advance. About the health recording, another intervention is about modernizing the health recording methods, maybe by introducing health, electronic health records machines so that they can help in storing the data. In case they want to make formulate an health plan, it can be good for them because this is a way that they can go directly, they retrieve the information so easy so that they can do other things that can help to improve the health. Also, another thing is about training and training the health providers on basic skills that are required in providing quality healthcare services. So we have seen some healthcare providers are having some basic knowledge about giving quality education. I mean quality services, but they are lacking some skills. There is a gap of skills where most of them they don't understand. So they need to be trained maybe in different ways, in various ways they can be more effective so that the the areas they are working to their best so that they can provide best services. Another important thing is about providing resources to the health facilities is one of the interventions that can use to solve the problem of improving the quality health in hospitals or health facilities. This is because you find that in most of the developing countries, they they are lacking some basic equipment and tools that are very essential to treatment of people. This can be maybe, for instance, in a given area you find that an hospital is lacking some drugs, basic drugs, maybe of malaria, because of the high cases of malaria in the region. You find that people are traveling in a far distance to seek medication, which is not right. So the government involved, for instance, should take their best interest to ensure that the right drugs are delivered, and also other areas which are so common are solved. They can also ensure that counterfeited drugs are not on the market, because they also put the patient at risk of getting contradiction, health complications which are not good. So I think this video has been useful to every one of you, and I hope it has given you basic of the knowledge that we need in quality healthcare improvements. Thank you.